Okay, hello everyone. Good evening. My name's Roger Crystal, and I just want to start by saying thank you everyone for attending. I think it's a fantastic acknowledgement that there's something to be done here. People need educating, and taking this step is important. So thank you for your time by being here. I want to just start by almost saying, sign the disclaimer, so to speak, or my disclosures. I'm a surgeon by background, but I'm not a practicing physician in this country, and certainly no one here should be regarded as my patients, so please don't regard this as specific medical advice directed at you. What I do for a living, I'm the CEO. I run a company called Opioid Pharmaceuticals, and Opioid actually receives money when this product, the NARCAN nasal spray, is sold. So I think it's important people are aware of that. However, the good news is, as you'll hear through my talk, you don't have to be using NARCAN nasal spray specifically. There's alternatives available. There's a generic version. So I'm not in any way saying it has to be this one or nothing else. And the views that I'm representing today are my personal views. They're not the views of my company either. And the final thing is, please don't be offended. I'm not out here to offend. It's a very controversial topic, and I come from a very medical and scientific background, very data-driven, and that's the approach I deploy. So not out to offend, and happy to have the conversation. And with that in mind, just two things. I'll go through the presentation. I am happy to take as many questions as there are afterwards. And feel free to ask whatever. I really think it's important, there's no stupid questions. If I've said something, you don't quite understand it, please ask me to elaborate. And if there's time, I'm happy to also talk a little bit about cannabis and the dangers that represents for teenagers as well, because I think that's also an important topic. Oops. So about myself, I'm originally from the UK, so I hope you can understand me speaking. I'm from Manchester, the north of the UK, and I worked as a surgeon for about 5-6 years, predominantly in London. The link, once the presentation is shared, you can watch the link. The day I became a US citizen, just last year, was the day I actually had to use NARCAN nasal spray on the streets, so you'll see how easy it is to use it. And I've been based here for 8 years. I'm a very proud Pali High parent. My daughter's a sophomore, and I have 3 more kids, hopefully coming to Pali High as well. So I'm extremely invested in making sure that our communities are safe. So I'm going to talk a bit about how we got to where we are in terms of the opioid crisis. I think understanding where we've come from can help you understand where we are and where we might be going. It's quite a kind of interesting story, and there's many people that have a role to play. Talk about what opioids do, and therefore what is an opioid overdose, and then why fentanyl in particular. The fentanyl thing is the most relevant part of this whole talk in many ways, because it's really representing a threat to teenagers. And then exactly what is naloxone, what's NARCAN, what can we do about it? So the opioid crisis is one of the biggest health threats today. More people die from an opioid overdose than road traffic accidents, than people that were dying from HIV, from gun crime, which is obviously also a very scary part of society. And very few people saw it coming, and the reason we're talking about it now is because of, as I said, the threat to teenagers in particular. And opioids are essentially chemicals that go into the brain, and they act on opioid receptors. And going from left to right are examples of opioids which get increasingly more strong and dangerous. So the most mild opioid out there is codeine. And then you have drugs, prescription medications such as OxyContin, Vicodin, Percocet. They're pretty strong. You can overdose on those. And then you have heroin. I'm sure many people have heard of heroin. And now they say that the latest threat is ones like fentanyl and even more dangerous, carfentanil. And we can get into that. This chart, I think, is really interesting. Maybe that's the geek in me, but the reason I think it's interesting is because it shows how this opioid crisis has changed over the years. So in the 1990s, opioid addiction and opioid overdose was really the typical, it was confined to the people on the street who were injecting heroin, becoming addicted, overdosing. And then we had in the US, and this is what's so kind of interesting, scary, controversial, is that in the US we overprescribed these opioid painkillers in huge quantities, hundreds of millions every year. And that caused opioid addiction and opioid overdose to get out of control. And in basically from 2000 to 2010, I think there's a pointer here. Let's experiment. Maybe not. Okay. But in 2000 to 2010, that's where opioid addiction and overdoses really ramped up from these painkillers. And then as the painkillers became harder to get hold of, we had people then switching back to heroin. So from about 2013 to 2018, opioid overdoses predominantly from heroin were the main perpetrators. And you had heard stories of soccer mums overdosing and getting addicted to heroin, which is scary in itself. And in recent years, it's now become fentanyl. So fentanyl is easier, cheaper to get hold of now than heroin. It's more addictive. And originally, the main people abusing and overdosing on heroin were people who were already hooked on opioids. And they thought they were getting heroin, but they were actually getting it laced and contaminated with fentanyl. But it was still confined to people who had addictions. But what we've seen in this last year is the rise of the opioid naive overdose, meaning someone who's never had an opioid before, thinking they're taking something such as marijuana, illegal Xanax or Adderall, and it's laced with fentanyl. Another way of thinking about it, if I see someone on the street, 50 years or younger, and they're unresponsive, it's an opioid overdose until proven otherwise. It's not a heart attack. It's not a epileptic seizure. It's not diabetes. Statistically, it's going to be an opioid overdose. And within that, it's going to be a fentanyl overdose. And the issue is you don't know whether it's fentanyl or regular heroin. Just from the statistics alone, we assume it is fentanyl. So how we got to this point, I look at this as called the Swiss cheese. And I'll go through these slides quite quickly. And it's just really saying that a Swiss cheese, for those of you that know cheese, is Swiss cheese, it has many holes. And when those holes all line up, the cheese falls apart. And I think of this opioid crisis as the cheese having fallen apart because there's been several holes coming together, lining up to create this terrible situation. And the main cause of this has been the illegal marketing of opioids by companies you might have heard of like Purdue, who marketed OxyContin, and they were telling everyone, telling doctors, these opioids aren't addictive, when really they are. So this, you can see this is an advert from OxyContin. Oops. And then they actually supported lobbying hospitals, regulators, medical groups to get pain recognized as this fifth vital sign. So we've got to treat pain as intensely as we treat someone's breathing, or as intensely as we measure someone's heart rate, for example. And that drove over-prescribing to eliminate all pain, so massive uptake of these opioid painkillers. And then what's unique in the US is that in the US, we're allowed to market and promote and have advertisements to us, consumers, to patients directly. Whereas in every other country, Australia, France, UK, you can't advertise to the general public. You can only advertise to doctors if you're a pharmaceutical company. The other thing we can do here pretty easily is doctor shopping. So I get 30 opioids from Dr. A, and then I go to another doctor, get 30 more, and another doctor still, and get 30 more again. So before you know it, I've got a whole stash of opioids when I didn't probably need any at all in the first place. And then the other issue in pharmaceutical companies, not now thankfully, is essentially bribery, where they could provide massive gifts to doctors to incentivize them to prescribe their drugs in massive quantities. So there's a few other considerations about where we got to, but I'm not going to go to that now. Let's talk about why opioids are addictive and what's an overdose. When you take opioids, they act in 3 different ways. They do a good job if you get the right patient in dealing with pain. However, at the same time as doing that, for many people, they make you feel high. They make you feel good. That's why they are addictive. What's happening is when the opioid goes to the brain and goes into the opioid receptor, you release dopamine. Have people heard of dopamine? It's the feel-good drug. It's the body's own drug that gets released. But at the same time, in so doing, it's also slowing down breathing. The opioid itself goes to the breathing center. And typically, you're not aware that your breathing is slowing down. And this is what's happening in an opioid overdose, especially for patients who have addictions and they're trying to get high. All they're aware of is feeling really good. And then their breathing slows down. They're not aware of it. It's someone else that observes that someone is unresponsive. Their breathing appears to be slow. They might appear pale. There's several other features as well, but I think the most important is just generally being unresponsive. And that is essentially an opioid overdose. The brain, the body's, we're sat all here breathing automatically. You're not thinking about whether to take your next breath, but when you overdose on an opioid, the body's automatic drive is taken out. That's what makes it so dangerous. And we'll get it with fentanyl and other such opioids, they act so much faster that breathing can slow down much faster, and therefore people can die more often. That is the reality. So fentanyl, carfentanil, there's other types of fentanyl, are all categorized as synthetic opioids. What does that mean? That means they are made in a lab. So heroin comes from the opium poppy. So why are we seeing so much fentanyl out there? Well, because it's cheaper and easier to make than heroin, and it gives you an even more addictive, impressive high. So for drug dealers, they're highly incentivized to substitute heroin with fentanyl and put fentanyl into other drugs such as cocaine, cannabis, again, Adderall, all these other drugs, to make them feel, give the customer an even greater high. They don't care. Drug dealers don't care whether someone dies or not, because frankly for them, it's still a low proportion of the overall people that they're selling their drugs to. But it's a lot more dangerous situation for the person taking the drug. You can see this picture here. It's a little bit blurry, but you can see the relative amounts of heroin, fentanyl, and even more dangerous carfentanil that can kill someone. So you can see it's, for fentanyl, it's maybe in the, I would say, 20 granules of fentanyl, which is when we hear on the news about 20, 50, 100 pounds of fentanyl being seized by the DEA, for example. You think, well, I don't know, 50 pounds, that doesn't seem a lot. 50 pounds is maybe, I don't know, a third of my weight, maybe less. And yet 50 pounds of fentanyl is lethal for 1 million, 2 million people. The other issue, not only do you have to act faster now than ever before because of fentanyl acting so fast, what we're seeing is multiple doses of naloxone are needed. So in the past, when it was a regular heroin overdose, just one squirt, one nasal spray would be sufficient. Now we're observing that multiple doses typically needed to be used to initially resuscitate someone. And the other risk of fentanyl is what's called re-overdosing. So what happens is naloxone wears off, but you still have higher levels of fentanyl in the blood, so you can re-overdose, which is why it's important to keep with someone who's overdosed until the definitive help arrives. So what is naloxone? Naloxone is another medicine that blocks opioid receptors in the brain. So what that means is when you overdose and you've got lots of fentanyl flying around in the brain, attacking opioid receptors, the naloxone is keeping the fentanyl away from those receptors. And in so doing, it allows the brain's automatic breathing to be restored. So that's how a life is essentially saved if you intervene quickly, which is why it's so important that we have naloxone available as close to the overdose as possible. That was the whole reason that why did I invent the NARCAN nasal spray? Well, because before a nasal spray was around, we only had injectable naloxone available. And as an injection, the only people that were willing to use it or even really allowed to use injectable naloxone were paramedics and physicians. But by the time the naloxone got to the patient, it was often too late. The beauty of naloxone, and again, I'm not saying specifically the NARCAN nasal spray, but naloxone in general, is it's very safe. You can't actually overdose on naloxone. If I took 50 sprays of this up my nose now, I'd probably have a headache, I'd probably feel nauseous, but I'd be fine, absolutely fine. The other question I am often asked is, what if it's a heart attack? What if someone hasn't overdosed on an opioid, but it's something else? And the point is, it's absolutely fine. You're not going to make a heart attack or an epileptic seizure. You're not going to make something worse if you got it wrong. In fact, it can be useful for when paramedics arrive to say, well, look, I gave multiple doses of naloxone, nothing worked. It might make them think, well, maybe it was something else. So no harm done if you give it and you got it wrong. And it's not addictive. It's not, you can't get, not only is it safe, you can't get high on naloxone. It's called an opioid antagonist. It's quite the opposite. So in general, when you encounter someone that's unresponsive, as I said, this day and age, unfortunately, we have to assume it's an opioid overdose until proven otherwise. And the idea is to give naloxone as quickly as possible. My advice, if you have 2 doses, go straight for 2. If you feel that the patient's breathing somewhat, but the breathing is labored, you can give 1 dose, wait a couple of minutes, and give another. The instructions inside this or any of these products are very simple and easy to follow. But the point is to administer naloxone, call for emergency services, put someone in the recovery position. They have diagrams in the packaging what that looks like, but simply put, it's putting someone on their side, in a side position. and staying with them until help arrives. In general, what else can you do in terms of thinking about getting smarter about opioid addiction, opioid overdose, the opioid crisis? Well, there's some very good resources on NIDA. So NIDA is the National Institute on Drug Abuse. It's part of the NIH. So they have some very comprehensive information there. On a personal level, I think if you still, doctors have wisened up to this more so than ever before. I would always put to you, if you're prescribed 30 days of an opioid painkiller for anything these days, one should challenge that and keep those pills in a very safe place and discard them when you don't need them anymore. Just for some context, say my specialty when I was a surgeon was ear, nose, and throat surgery. When we did a tonsil surgery on an adult, which is quite a painful procedure, they wouldn't get any opioids. They would get acetaminophen, Tylenol, and Advil. Whereas here, it used to be that someone would get 30 days of OxyContin, no questions asked. That's getting better, but I would still recommend to push back. And for people who have chronic pain, opioids really aren't the medication of choice. Things like physical therapy often do a lot more benefit for patients rather than just putting someone on long-term painkillers. And I've mentioned already, yes, discard unused opioids safely. And yes, do carry naloxone. The one thing I didn't mention is as I said, well, I did say it earlier, that there is, naloxone is officially, technically, a prescription medication, but in every state in this country, there is a standing order, meaning you can go to the pharmacist and request naloxone, and they will give it to you without a personal prescription. Essentially, what's happened is the medical director of California has prescribed naloxone to all of us. And if you have insurance, it's like $5 copay or less. Have it in the car, have it at home, it's safe. So really, that was all I had to say this evening, but I will take any questions. I can mention a bit about cannabis as well, whatever works. But thank you for being here and listening. So that's a question about what's causing the inflow of drugs, the fentanyl, into this country. I mean, simple economics, it's supply and demand. As I suppose drug dealers observe that the customer base, the increase in opioid addiction, we started by causing millions of people becoming dependent and addicted to opioids. So drug dealers are money-making machines. So how can they supply a cheaper drug to their customers? Well, it's fentanyl. And the fentanyl initially was, it's all kind of China, Mexico. But the thing to be aware of, even if we get better, and I think there's an improvement in how we prevent the flow from overseas into this country, because fentanyl is quite easy to make, it wouldn't be hard for people to set up shop within the US.
Why are teenagers specifically seeing such a rise? Like, are they taking, I assume it's not just cannabis and marijuana. Like, what is it that they're big drug users? I mean, why, like, I've seen ads
teenagers?
that are their colored pills. Is it that they're being, packaged differently, that a young kid wants to go buy that? Like, is it only in a drug? I'm trying to figure out why it's about teenagers.
So why teenagers? Why is it all about teenagers?
Sorry.
I mean, teenagers in general, ever since I was a teenager, like to partake in risky activities, push the boundaries. And in my day, it was alcohol and cannabis, and other people would, over generations, whatever's trendy. I think the most recent impact is social media and the ability to access Xanax, Adderall, marijuana online. That's the beauty, quite the opposite of the beauty, but the advantages of social media is the targeted manner in which you can effectively market these types of drugs. So teenagers have lapped that up. They're thinking, yeah. That's maybe I didn't make that clear. Thank you. It's not that teenagers typically are thinking, great, the Xanax is laced with fentanyl. Quite the opposite. They believe it's Xanax. But the point is rolling the dice each time that happens.
We went to a really moving, not to take away from what you're saying, but we went to a really moving something that was at another school yesterday, at my daughter's school, and it was given by a father who lost his 23-year-old to it. So it was coming from a kind of a different perspective, and so I felt it was really informative. The couple points I maybe just wanted to add, since we're in a high school arena, and maybe you can tell me the law that he said. It was something about, I just think it would be helpful, like if your kid is at a party and they think something's happened to somebody, there's some statute or something in California that if they call 911, they're not going to get in trouble. I think that's a really good point to, especially since our kids are starting to go to parties and things like that. And then maybe they're scared, and his kid was older, he was 23, but he also thought he was taking Percocet, and he didn't call it an overdose, he actually called it a poisoning, because the kid didn't really overdose, he actually thought he was taking something different, but it wasn't an actual prescription, it was on Snapchat. So my takeaway, or what I wanted to say, is more that I think it's important, if you know that law, if anybody knows the actual law, the Good Samaritan law, that if your kid is at a party and they see that one of their friends, this has happened to them, and they're going to be scared, because sometimes kids will leave their friends, which we'd hope none of our kids would ever do, but they'd be scared they'd get in trouble. I think that's just something I wanted to share with the whole community of Pali High, because you never want to leave a friend, number one, but people are scared. So if you want to share what that exactly
thank you for sharing that.
And then just, I'll add one other thing after that, but it's more about the prescription.
No, so briefly, your comment is correct that in California we have a Good Samaritan law. So if you report an overdose, or you yourself are, there's safe harbor around that, you're not going to get in trouble. So there's no reason to abandon an opioid overdose or any kind of overdose. Stay there and be helpful. And
that was one big takeaway I took from yesterday, and the fact that it is that they think that they're taking something else. It's not that they think they're taking fentanyl. And then I did get the prescription today at CVS in the Palisades, by the way, because this was a really moving what we saw yesterday. And I got the generic, but it was $20, and I think for the actual it was like $60. So I don't know. Maybe eventually everybody will be able to access it, but that's what happened for me today, and it was available at CVS. But
I mean, that's a good point. A lot of pharmacists, the issue is awareness around the fact that you don't need a prescription, and in fact, this is awareness of Naloxone, and in some places, the pharmacists themselves don't realize, which I find I find that frustrating, but that's just where things are. So sometimes the pharmacists need to be told, no, you can dispense this. Sorry?
one pharmacist got it, so he has another one. He didn't know.
Yeah.
He says, I got it, but I really don't know how to handle it.
Exactly.
So I was just curious, and then I went to CVS just to see, because I think it's just important that we all have one, like you said. And I didn't do anything but my driver's license. I filled out a piece of paper, and that was it. So I didn't need an actual prescription.
Exactly. Yeah. You shouldn't need a prescription.
It's interesting to get a pharmacist.
Yeah. So there's still more awareness that needs to be out there. Yeah, I'll take a question at the back first of all. Sorry.
Well, number one, thanks for coming. This is great. Different world from when we grew up, it seems like. You mentioned you can now find opioids in marijuana, which it's first I've heard of it. I've always sort of thought like marijuana and then all these other crazy, scary things. Can you talk more about how that's happening? And
Yeah.
is that like, because we now have a legal market for marijuana.
Right.
I feel a little ignorant. I don't know, is that where kids go these days, or is they buying it on Snapchat or whatever it is?
Yeah, that's a great question about marijuana. So the marijuana, the legal marijuana that one can purchase from dispensaries is safer. That typically, I don't know, I'm not aware of anything where that's been laced with fentanyl, because that's a legal supply chain. It's made in a manufacturing facility, distributed to the stores, and they sell it. So the issue, and this is why it's still an issue for teenagers, is clearly as a teenager, you can't go to a dispensary and buy cannabis, can't buy marijuana there. So teenagers still, if they're wanting to score marijuana, are buying it illegally on the street. And that's the marijuana that is reports of that being laced. You can get, I should have added, you can get fentanyl testing strips, and they're good, but I don't want to represent that they're 100% guarantee. It's a bit like COVID testing in some ways. It increases the level of confidence, but there's no guarantee that just because it's negative for fentanyl, there is no fentanyl, because a bit more like COVID is there's different variants. So carfentanil wouldn't get picked up even if it tests. So you could be positive for carfentanil, but negative for fentanyl, if that makes sense. But it's better than nothing. Question? The difference between fentanyl and carfentanil, from a chemical similarities, and they both work on opioid receptors. They're both opioids. Carfentanil has a slightly different structure to it, and in so doing, makes it that much more potent again than fentanyl. So fentanyl's like 50 times stronger than heroin. Carfentanyl's like 500 times stronger than heroin. Carfentanil, just for some history buffs, if people remember in the early 2000s in Russia, there was an opera house that was taken over by Chechnyan rebels, and they took hostages. And the Russians tried to sedate the rebels and gassed the opera house, and they used carfentanil, but in so doing, killed over 100 people. So this is dangerous stuff. I mean, Dr. McGee, maybe you want to comment on what the school policy is.
So, I mean, at this point, the school has NARCAN, and we do still have policies.
Oh, sorry. So the question was, yeah, that's a good point. I'll give you the mic, but the question was basically the school's provision of naloxone.
So, I mean, so we do have, I think a nice supply on hand. And at some point, when we have more, our intent is to have a prescription. We'd like to have some in every classroom. We're just not at that place where we have that much on hand. But for students who are like bringing any type of a substance on campus, we do want it checked in with a nurse's office. So I don't want to encourage them to bring it in a backpack or bring it to school, but it's not a bad thing for them to have at home or perhaps in their car. But I mean, I'm not recommending them necessarily they bring it into school at this point. Okay, because we do have it here.
No, but we just donate it to the school.
We'd love it. Yeah, yes, we'd love to have it. We want to have that as much of a supply as possible. So thank you for that.
You would be able to intervene quickly enough if you've got it on the site without it needing to be on.
And I guess the one thing I would want to say to everybody here, because I know you're all kind of wondering, like, what's going on? In our position, I mean, first off, thank you so much, Dr. Crystal, for coming and speaking. He's already spoken to our whole faculty, which I think was really, really important for us, so that they have a higher awareness. But again, and we'll certainly be speaking, also be speaking with our middle school, so helping our whole community be more informed about what's going on and what we can all do about it. So all of these things are making, I think, will help us all feel like we're more prepared. But with our teachers, with all of our folks here on campus, we're trying to treat ourselves as first responders. That we've been learning like how to administer. It's not terribly complicated, but you do want to read the instructions and know what to do. So that's our position. Is like every adult to be a first responder and be prepared if something were to happen here. And again, now as we start training students, they'll be better prepared and be able to respond as well.
So does the student know about this? You already talked to the student? Or?
That's I think our next phase is like talking with them like what and for you, I mean obviously for you all to have these conversations with your kids.
Question.
How do you need to get it in all the classrooms? Money?
Question to get.
Like you can't get, it's just low supply.
Yeah, I think even the reasonable stockpile here, it sounds like what you have is decent because, again, the response time is minutes. It isn't seconds. So, but the time frame I think is decent. Question over.
Can fentanyl be in vaping?
Say what?
Can fentanyl be in vaping? People who
Confe-
vape?
yeah, I mean, fentanyl is. People vape all different kinds of substances, and therefore, sorry, I've been told to stand here. Fentanyl can be in all kinds of substances. So, people who are addicted to opioids, addicted to heroin, and therefore deliberately abusing fentanyl will inhale it, vape it, snort it, however they want to get it into them. I think for our population here, people won't. I'd like not to think people aren't going to deliberately be vaping fentanyl, but they might be vaping marijuana that is laced with fentanyl. So if the marijuana they're vaping is laced with fentanyl, absolutely that will represent a big problem.
Is it like, do they put it like in brownies, like in cookies, like that kind of modality?
It can be, yeah. Yeah. Any other questions? Yeah. So your question was, are we going to do a social media campaign? There are campaigns out there. Me as a company, well, my company's not marketing, although we make money on NARCAN, we're not marketing it ourselves. So it's not up to us, it's up to our partner. There are several different types of social media campaigns. Actually, most of them are public campaigns. So, in fact, the slide has gone down now. The last slide I showed was a 70s image of saying carry naloxone. That was on billboards in Washington, D.C. So it was their public health authorities who had funded those sorts of campaigns. But there's several campaigns out there, actually. Any other questions? Yeah.
First of all, just thanks for being here. I think it's great you're bringing this awareness, and frankly, I wish there were more people here to hear this. But just a quick question on the nasal spray. Does someone have to be breathing in order for that to be effective?
That's a great question. Does someone need to be breathing? No, as long as they have a pulse, essentially, because what's happening is the nasal cavity is very well vascularized. So as long as there's blood flowing there, then it gets very well absorbed. And in fact, in the clinical trials we did to get the product approved by the FDA, we had healthy volunteers hold their breath and check it was well absorbed even then.
I was going to add one more thing just that I learned that I knew nothing about
Great.
this fentanyl thing until last night. I mean, I knew something, but to me it was surprising that I just wanted to share one other thing about that. Basically, if someone's falling asleep and you can't wake them up, that's a big sign of it.
Yeah.
And I didn't know that until last night. So in all the examples that we talked about, teenagers, 20s, whatever, their friends just think they might have just passed out from
Right.
drinking too much or smoking weed. But actually, we were told last night, if you shake your friend or whoever that is and they're not waking up, there's a problem. So I felt like that was one other point I kind of wanted to
absolutely.
share if we're discussing this, because I never knew that.
Yeah.
And again, the son that died, 2 roommates walked right by him. He was playing video games and he just fell asleep. That was it. and then nobody knew, so I think that's something that we should wear, and our students
Yeah, the
should
game
be
has
aware of.
changed.
So that freaked me out a bit, so.
Yeah, in my day, if someone was unresponsive, you would assume it was alcohol or cannabis, but now it's fentanyl. In the sense, the good news is, if, as I mentioned earlier, if you get it wrong and it wasn't fentanyl and you gave naloxone anyway, that's fine. If it's an alcohol intoxication, if it's a cannabis intoxication, you give NARCAN, it's fine. They're not going to be any worse off. A question at the back? Hold on.
I'm not sure how much information has gone around as far as people sharing resources, but there is an organization called Overdose. Do you know them?
I don't know them, but please.
Essentially, they take you through almost like a 20-minute course on educating you about an overdose, the differences between different types of overdoses, and what to look for. And you sort of have to take a test as you're going through each section. And then afterwards, once you complete it and pass it, you're sort of certified, and they'll send you 2 doses of Narcan free.
That's great.
You just pay
Thank
for
you.
it's called, I believe, endoverdose.org.
That's great.
Yeah.
I mean, one thing I would add is the other challenge in all this is that often people are abusing more than one drug at the same time. So the danger is you think they might smell of alcohol, so you think, oh my goodness, it's just an alcohol kind of, they're down and out because of alcohol. They're not responsive, but it still could be fentanyl from something else they've taken as well.
They also said in that, and a good way to test, I don't know if you agree with this, is that there's a rubbing on the chest that you do, and if it's someone that's passed out from, let's say, too much drinking or whatever, they will revive them. They'll revive to a degree or something if you rub them, like one of the techniques.
No,
And
absolutely.
they stay.
A chest rub, that's what I used to, when I was working in the ER as a physician and dealing with
Yeah, and the eyeballs.
tons of, eyeballs.
Yeah, I mean, it was very
Chest
good
rub.
for the lay people out here that
Yeah.
don't do that, it forces you to stay with it so that you are actually paying attention to it so that you can pass to the next point.
That's great.
And it was really super helpful. So,
Thank you.
Hi, Brett Spada. I'm from Revere.
Hi.
Revere is hosting Roger Cristal next week on Wednesday, the 26th. If you know people that are not here, please post it on social media to your friends and let them know that Revere has a 900-seat auditorium, and Roger Cristal will be giving this presentation that you saw today. I really feel like it's important for this community that I work in that we reach out to the families. I have a friend who works at El Camino High School where they lost a baseball player last week, and the fallout of losing a student to a drug overdose, it's really, really rough on a campus. I would hate for that to happen in this community. So please encourage friends to come out to his presentation next week too. I think the more we get it out there, the better this community is going to be.
Okay. Oh,
Hi. Oh,
hi.
I feel like singing. Thank you for coming. So I have a question about social media. Are there any platforms that can ping you as a parent if something's popping up, like on Snapchat or TikTok, where they're talking about a drug or Xanax or chit-chatting or code words that people are using that we don't know because we're old now?
Yeah, I'm old too. I don't know. If anyone else knows, please share. But I can find out. I just developed drugs. No, sorry. I don't know. But the family, actually the local family that are, one thing I will say, a well-known family in Santa Monica who lost their son within the last couple of years, the Bermans, she's Dr. Berman and Sam Chapman, they've been quite prominent because it was a fentanyl overdose, and the son, again, I think it was Xanax. He was intending to score. It was laced with fentanyl, and he obtained it through social media. So I know they've been pretty active in the social media side. I just can't remember. I'll try and look it up, but they're doing stuff. He ordered it through Snap, but in terms of what they're now doing about it, to try and combat this aspect. Any other questions? They've been great questions. I didn't think there'd be that many, but thank you very much for all the questions. One thing I'll just very quickly add. Sorry, very, very quickly. Although this is about opioids, a 30-second primer just to say that marijuana, cannabis, is a lot more dangerous now than ever before. Aside from the fact that it's essentially laced with fentanyl, it's because it's now being vaped. The amount of what's called THC, which is the drug that gets you high, the part of cannabis that gets you high, so much more is getting into the brain than cannabis that people were taking 10, 20 years ago. So that has become a kind of a different beast itself. So when people used to think it wasn't addictive, actually it kind of is addictive. There's a disorder called cannabis use disorder. It can make people psychotic. It can have severe, can impact the developing brain. So I just want to call that out as well as we're talking about these important topics. So yes, I will shut up, let everyone go back home. But thank you for listening.
Thank you, and thank you for coming tonight. And I guess for everyone, I appreciate again that Revere has their presentation, and we did record tonight, and we will post. So if you know folks who aren't able to get to the other presentation live, you can let them know that this will be posted on the homepage of our website in the news and announcements section. So again, all of us, I think, trying to get the word out as much as possible. And to parents in the room, if you run across a resource that you feel comfortable for us sharing as a school, it's been very delicate. Like, we've tried some different things to send out kind of globally, and there's such a high level of sensitivity in what some students are just extremely sensitive, and some of this material is maybe too graphic for some. So we're looking to you as parents to kind of give us some guidance on what you feel most comfortable with your students seeing and being shared with them, but certainly encouraging you, have those conversations. We are thinking about, we're going into a homecoming weekend, lots of activity, lots of kids doing things together. Again, these are teenagers. They're going to be out doing things. So the more information we can get in their hands, the faster we can get it there, the better for us all. So again, thank you for your concern, and thanks for being here tonight.